Seniors, regular health checkups are often seen as the key to staying safe. But what many seniors don't realize is that after age 70, some of the most common medical tests can actually do more harm than good. These screenings, often recommended as routine, can lead to unnecessary treatments, risky procedures, and even long-term complications, especially when there are no symptoms present. This doesn't mean you should avoid all testing, but it does mean you should ask smarter questions. Will this test actually help me? What happens if it finds something? Is there a safer option? In this guide, we'll uncover 5 health checkups you should think twice about after 70, what they really mean, why they're often overused, and what to consider instead. Each is backed by Checkup No. 1. Full-body CT scan. Why this preventive test can do more harm than good after age 70. Full-body CT scans have become increasingly popular in some private health clinics and executive wellness packages. Marketed as a way to catch cancer, aneurysms, and other hidden conditions early, their allure is strong, especially for adults over 70 who want reassurance about their health. However, this test comes with a significant drawback. It exposes patients to high levels of ionizing radiation, equivalent to approximately 500 chest X-rays per session. That radiation isn't harmless. Studies have linked excessive exposure to an increased lifetime risk of developing cancer. A 2023 modeling study published in JAMA Internal Medicine estimated that CT scan overuse could now account for up to 5% of all cancers in the United States, a figure comparable to cancers caused by daily alcohol use. Moreover, full-body scans frequently reveal incidentalomas, small nodules or calcifications that are typically benign and common as people age. These findings, once noted, often lead to a cascade of further testing. Targeted CTs, PET scans, needle biopsies, follow-up surgeries, and potentially even major procedures to remove harmless lesions. In truth, most of these follow-ups uncover nothing dangerous, while exposing patients to risks like bleeding, organ damage, anesthesia complications, and severe psychological stress. Marcus's story brings these dangers into stark relief. At 80, Marcus was an active martial arts instructor with no health complaints. Intrigued by his private clinic's full-body preventive scan, he decided to check it out. The results showed a tiny 3mm lung nodule, a common finding in older adults. Though the scan described it as likely benign, medical protocols prompted a PET CT for further evaluation, followed by a needle biopsy. The biopsy ultimately revealed nothing malignant, but it collapsed a portion of his lung. Marcus was hospitalized for over a month, suffered through respiratory therapy, and became fearful of any exertion. All of this from a scan that was never needed, and a nodule that posed no measurable threat. This kind of harm is all too real, and rarely discussed in marketing materials or glossy brochures. Some patients feel safer knowing everything is being checked, but what they don't realize is the scans themselves may create more problems than they solve. Leading radiology guidelines strongly advise against full-body CT scans for asymptomatic individuals. The American College of Radiology and similar organizations maintain that unless there are specific symptoms, like unexplained weight loss, persistent cough with blood, evidence of aneurysm, or localized swelling, these tests should be avoided entirely. Indeed, a targeted scan based on clinical need is always safer and more appropriate. Checkup No. 2. Colonoscopy. Why this routine procedure can be riskier than you think after age 70. For decades, colonoscopies have been considered a gold standard in cancer screening, recommended routinely every 10 years, starting in middle age, to detect and remove potentially cancerous polyps before they become dangerous. But what many people don't know is that past the age of 70, especially after 75, routine colonoscopy can do more harm than good. It's not that colon cancer isn't serious. It is. It's the third leading cause of cancer death in both men and women. But the crucial word here is screening. In medicine, screening refers to testing people who have no symptoms. And for older adults, especially those in relatively good health with no history of colon issues, the risk-to-benefit ratio of a screening colonoscopy changes dramatically. Let's break this down. First, the procedure itself isn't without risks, far from it. Colonoscopy preparation involves powerful laxatives that aggressively clear the bowel. This can lead to dehydration, electrolyte imbalances, dizziness, and even kidney injury, particularly in seniors whose systems are more sensitive. The procedure also typically uses sedation, which carries its own set of risks in older adults, including confusion, memory lapses, heart rhythm issues, and even falls after waking. Even more concerning, the scope used during colonoscopy can, in rare cases, cause direct harm: bowel perforation, a small tear in the colon wall, internal bleeding, or inflammation. A study published in JAMA Internal Medicine in 2019 analyzed over 1.3 million Medicare patients aged 70 and older who underwent colonoscopy. The findings were eye-opening. For every 1,000 procedures done, only 2 lives were extended due to early cancer detection, but over 20 people experienced serious complications. That's a 10-1 risk-to-benefit ratio. But what about polyps? Isn't removing them always a good thing? Not necessarily. Many polyps found in older adults are small, non-aggressive, and very slow-growing. Some may never turn cancerous at all in the remaining lifespan of a healthy senior. Removing them can sometimes cause more trauma than leaving them be, especially if the removal is difficult or requires follow-up surgeries. Let's take a real-world example. Dana, a 73-year-old grandmother and bakery owner, had always been in excellent health. She ate well, walked daily, had no digestive complaints, and had 2 previous colonoscopies that came back clean. She had no symptoms, no bleeding, no bowel changes, no family history of colon cancer. But when she switched doctors, her new physician insisted she get back on schedule and pushed for another colonoscopy, citing outdated screening guidelines. Reluctantly, Dana agreed. The prep was difficult. She experienced nausea and dehydration, but she pushed through. During the procedure, a small polyp was removed. Hours later, Dana began experiencing intense abdominal pain and collapsed. She was rushed to the emergency room, where doctors discovered a bowel perforation. She spent 9 days hospitalized, lost 10 pounds, and endured weeks of recovery. Her energy, confidence, and independence were never quite the same. All this for a screening test she didn't truly need. This isn't a scare tactic. It's reality for far too many older adults. And while colonoscopies are life-saving in younger patients or those with warning signs, for most people over 75, the U.S. Preventive Services Task Force now recommends against routine colonoscopy screening, unless there are clear symptoms or very high-risk conditions. Even between ages 70 to 75, it's essential to weigh the person's overall health, screening history, and life expectancy. So, what are the safer options? If you're still in good health but want peace of mind, non-invasive stool-based tests like the FIT, fecal immunochemical test, or Cologuard are excellent alternatives. These are simple at-home kits that detect hidden blood or DNA markers in your stool that may indicate colon changes. They're affordable, painless, and don't require sedation, fasting, or bowel prep. The FIT test in particular has a high detection rate for the kinds of colon cancer that typically affect older adults and is recommended yearly for most seniors in lieu of colonoscopy. Another key factor is symptom awareness. If you experience unexplained weight loss, rectal bleeding, changes in bowel habits that persist, persistent abdominal pain, then yes, further testing, including a colonoscopy, may be warranted. But in the absence of these red flags, you don't need to just get one because a form tells you to. Talk with your doctor about whether you've already been adequately screened in the past and whether continuing with invasive tests really offers benefit or just stress. What it all comes down to is individualized care. Medicine is not one size fits all, and that's never more true than in older age. What protects a 50-year-old might not help a 78-year-old. What's life-saving for one might be risky and pointless for another. In later life, your health goals shift, from extending life at all costs to preserving quality of life. That means avoiding hospital stays, risky complications, and unnecessary worry. A colonoscopy may still be appropriate in some older patients, but it should never be automatic. Be empowered to ask, why is this test being recommended? What happens if it finds something? Will it change my care or just lead to more tests? That's the kind of thinking that leads to safer, smarter aging. Checkup No. 3. Cardiac stress test. Why this common heart test can do more harm than good after 70. Once seniors reach their 70s, complaints like fatigue, chest tightness, or a general drop in energy often raise red flags for both patients and doctors. Understandably, there's a fear that these symptoms may signal heart disease, and the go-to response is often a cardiac stress test. This test evaluates how your heart performs under exertion, either by walking on a treadmill or through medications that simulate exercise. On the surface, it sounds like a smart, proactive step. But here's the truth. For people over 70 who aren't showing classic signs of heart problems, the cardiac stress test can be more harmful than helpful, and in many cases, downright unnecessary. The major issue lies in how the test works and how the results are interpreted. A stress test looks for signs of reduced blood flow to the heart that may indicate a blockage in the coronary arteries. But as we age, the body undergoes natural changes in circulation and heart performance, even in people without heart disease. That means stress tests in older adults have a much higher rate of false positives, indicating a problem where none truly exists. According to research published in the Journal of the American College of Cardiology, the false positive rate for seniors can exceed 40%. That's nearly half of all tests showing a supposed issue that isn't actually there. Now, why is that dangerous? Because a false positive doesn't end with the test. It usually leads to a referral for more invasive procedures, angiograms, catheterizations, or even surgeries like stent placement or bypass operations. While these procedures are life-saving in truly high-risk patients, performing them unnecessarily in otherwise healthy seniors exposes them to a long list of risks: bleeding, kidney injury from contrast dyes, infection, reaction to anesthesia, and prolonged hospital stays. It also creates intense emotional stress, all from a test that may not have been needed in the first place. A 2017 study in JAMA Cardiology followed thousands of older adults who underwent stress testing without strong symptoms of heart disease. Over 50% of the stents placed were in patients with stable or no symptoms, and these interventions showed no improvement in survival or quality of life compared to patients who received no procedure at all. What's worse, many of these patients faced complications that negatively impacted their health long term. Let's talk about Raymond, a 75-year-old retired postal worker who remained active by walking around his neighborhood every morning. During a routine checkup, he casually mentioned to his doctor that he sometimes felt more tired on uphill walks. His doctor, worried it could be his heart, ordered a stress test. The results were ambiguous, not clearly bad, but not clearly fine either. That ambiguity triggered a catheterization procedure to take a closer look at his coronary arteries. Doctors found a small narrowing and decided to place a stent just in case. Unfortunately, Raymond had a serious reaction to the contrast dye used during the procedure. His kidneys began to fail, and he ended up spending nearly a week in the hospital. He needed home care afterward, lost his appetite and strength, and didn't feel truly like himself for months. The most tragic part? His fatigue was never cardiac-related. It turned out to be from mild dehydration and irregular eating patterns. Raymond's story isn't rare. Seniors who were previously independent and functioning well can see their quality of life dramatically decline after going down the rabbit hole of unnecessary heart procedures. It's not because doctors are careless. It's because the system is geared to find and fix rather than pause and assess risk versus reward. So what should you do instead? If you're over 70 and not experiencing the classic cardiac symptoms, such as crushing chest pain during exertion, shortness of breath while walking, or palpitations with physical activity, it's worth holding off on a stress test. If there's some concern about the heart, safer initial evaluations include arresting EKG, electrocardiogram. This painless low-cost test checks for rhythm irregularities or signs of previous heart damage. A coronary artery calcium, CAC score. A non-invasive CT scan with low radiation that estimates your level of calcified plaque, providing insight into long-term heart risk without the stress of exercise or medications. These tests are often enough to guide next steps without jumping into invasive territory. Lifestyle is still the most powerful tool for heart health. Daily movement, a diet rich in vegetables and low in processed foods, stress management, and consistent hydration can do more for longevity than a stent ever could in someone who doesn't truly need it. Bottom line, a stress test in someone with no or vague symptoms may seem like playing it safe, but in reality, it's often playing with fire. After 70, we must start asking not just can we test, but should we? A more thoughtful, personalized approach to heart care will often spare you from unnecessary procedures, pain, and fear. Checkup. No. 4. Brain MRI for memory loss. Aging often brings with it subtle changes in memory. You might walk into a room and forget why, or struggle to recall a name that's right on the tip of your tongue. Naturally, this raises concerns about cognitive decline. The instinctive response, for both seniors and their doctors, is often to order a brain MRI, thinking that early detection is the best form of defense. While that logic makes sense on the surface, brain MRIs in seniors frequently do more to heighten fear than to clarify reality. These scans are incredibly sensitive and can detect even the smallest of abnormalities, many of which are entirely benign and age-appropriate. White matter hyperintensities, mild cerebral atrophy, and incidental cysts are all common in people over 70. Yet they often trigger a chain reaction of unnecessary worry, invasive procedures, and misdiagnoses. One major study published in Neurology Today in 2021 analyzed over 3,000 brain MRI scans from individuals aged 70 to 85 who had mild memory complaints. The results were startling. 86% of scans showed some type of brain change, but only 3% were linked to a condition that required medical intervention. Despite this, nearly 12% of the individuals went on to receive spinal taps, PET scans, or exploratory biopsies, all of which carry their own risks. The irony is that these interventions did not improve the patient's memory or quality of life. Instead, they often led to anxiety, side effects from sedatives, and in some cases, functional decline due to psychological stress. George, a 74-year-old retired engineer, is a striking example. He began to worry when he forgot the names of acquaintances and misplaced his keys a few times. His primary doctor ordered an MRI, which revealed minor white matter changes, common in his age group, but George panicked. Convinced he was developing Alzheimer's, he stopped driving, withdrew from social activities, and even began writing goodbye letters to his children. A second opinion showed that his cognitive function was well within normal limits. With reassurance, sleep improvement, regular hydration, and engaging activities like puzzles and music, his memory stabilized. Within a few months, he returned to his usual self, no longer ruled by fear. The takeaway? MRIs should not be the first step in evaluating mild memory issues, unless accompanied by severe symptoms like personality changes, seizures, or rapid functional decline. Cognitive screening tools like the Mini Mental State Exam, MMSE, or Montreal Cognitive Assessment, MOCA, are low-cost, effective, and far less invasive. Memory concerns are real, but the answer isn't always hidden inside a machine. Sometimes it's about slowing down, listening carefully, and using safer diagnostic approaches that don't make you a patient before you need to be. Checkup, no. 5. Bone density scan. After age 70, many seniors are routinely referred for a bone density scan, known medically as a DEXA, dual energy X-ray absorptiometry scan. This test is designed to measure bone mineral density and identify potential risks for osteoporosis. At first glance, the procedure appears harmless. No pain, no needles, and no lengthy preparation. However, what most people are never told is that this test can sometimes do more harm than good, especially in older adults without a history of fractures or falls. As people age, bone loss is natural, much like the appearance of wrinkles or gray hair. For most seniors, a mild decline in bone density is expected, and not necessarily a red flag. Yet, DEXA scans often result in a diagnosis of osteopenia, a condition that's considered a precursor to osteoporosis. Despite the fact that osteopenia is not a disease in itself, many seniors are immediately placed on potent medications such as bisphosphonates. While these drugs are intended to slow bone loss and reduce fracture risk, they often come with significant side effects, including esophageal irritation, digestive issues, and even osteonecrosis of the jaw, a serious and irreversible condition where the jawbone starts to die due to reduced blood supply. A revealing 5-year study published in the Journal of the American Geriatric Society tracked over 200 women over the age of 70. The researchers found that bisphosphonate therapy in those with mild bone loss reduced fracture risk by just 0.3%, an incredibly modest benefit. Meanwhile, the same group experienced a much higher incidence of drug-related complications. Instead of medications, many experts now recommend lifestyle changes that have proven more effective in preventing fractures. These include daily weight-bearing exercises like resistance band workouts, regular walking, maintaining a calcium-rich diet, and ensuring adequate vitamin D levels. These strategies not only strengthen bones, but also improve balance, coordination, and overall vitality. Consider Rose, a 76-year-old retired piano teacher who lived an active life, walking daily and never having had a fall. During her routine physical, her doctor referred her for a DEXA scan. The results came back showing osteopenia, and she was promptly placed on alendronate, a commonly prescribed bisphosphonate. Within 3 months, Rose began experiencing severe acid reflux and pain in her jaw, symptoms that disrupted her routine and made it difficult to play piano. a passion she had pursued for decades. After a reevaluation, her physician discontinued the medication and instead implemented a regimen of lifestyle modifications: daily walks, resistance training with light weights, and a diet rich in sardines, spinach, and fortified dairy. A year later, Rose was back to performing at community recitals, pain-free and with improved mobility. Her case illustrates how routine scans, while seemingly benign, can lead to a cascade of unnecessary treatments and side effects when not tailored to an individual's real risk factors. Ultimately, the best path forward for many seniors is not more medication but smarter prevention. Strength training, good nutrition, balance exercises, and sunlight exposure can significantly improve bone health and reduce fracture risk. For those without a history of fractures or frequent falls, it may be wise to skip the scan and focus on staying strong and mobile in more natural, sustainable ways. As you enter your 70s and beyond, it's tempting to pursue every available test in the name of prevention. But more testing does not always mean better health. Checkups like the DEXA scan, brain MRI, cardiac stress test, colonoscopy, and especially the full-body CT scan, each come with potential risks that can outweigh their benefits, especially when used routinely without clear indications. Instead, a more thoughtful and individualized approach to health in later life is warranted. Routine physicals, non-invasive screenings, symptom awareness, and lifestyle choices, like regular movement, balanced nutrition, adequate sleep, and connection, often offer far greater benefit than repeated high-tech scans and procedures. Be sure to ask your healthcare providers, why is this test being recommended? What exactly will you do if something is found? Is there a safer alternative? Remember, true prevention is not just about catching problems early. It's about preserving quality of life. And sometimes that means choosing less testing, not more.